Diabetes. Causes, symptoms, types, and treatment. Introduction. Diabetes is one of the most common chronic diseases worldwide, affecting millions of people each year. This condition is characterized by high blood sugar levels due to the body's inability to produce or properly use insulin, the hormone responsible for regulating glucose levels. If left untreated, diabetes can lead to serious complications, including heart disease, nerve damage, kidney problems, and vision impairment. In this article, we will explore the types of diabetes, its causes, symptoms, and effective treatment options. What is diabetes? Diabetes is a metabolic disorder that affects how the body processes glucose. Under normal conditions, the pancreas produces insulin, which helps transport sugar from the bloodstream into the cells for energy production. However, in diabetes, either the body does not produce enough insulin or it becomes resistant to its effects, leading to excessive blood sugar levels. Types of diabetes. There are several types of diabetes, but the most common ones include 1. Type 1 diabetes, an autoimmune disease where the body's immune system attacks insulin-producing cells in the pancreas, also known as insulin-dependent diabetes, typically diagnosed in children or teenagers, requires lifelong insulin therapy for survival. 2. Type 2 diabetes, the most common type, accounting for nearly 90% of all diabetes cases. The body produces insulin, but it does not use it efficiently. Insulin resistance. Associated with obesity, lack of physical activity, and poor diet. Managed through lifestyle changes, medications, and sometimes insulin therapy. 3. Gestational diabetes develops during pregnancy due to hormonal changes affecting insulin response. Usually disappears after childbirth, but increases the risk of developing type 2 diabetes later in life. Managed through dietary adjustments, exercise, and occasionally insulin treatment. Causes of diabetes. The causes of diabetes vary depending on its type, but some common factors contribute to its development. Genetics. A family history of diabetes increases the risk. Obesity, a major factor, particularly in type 2 diabetes. Unhealthy lifestyle, a diet high in sugar and processed foods combined with low physical activity. Autoimmune conditions trigger the destruction of insulin-producing cells in type 1 diabetes. Chronic stress affects hormonal balance, leading to fluctuations in blood sugar levels. Symptoms of diabetes. Common symptoms of diabetes include excessive thirst and frequent urination, constant hunger even after eating, unexplained weight loss, mainly in type 1 diabetes, extreme fatigue and weakness, slow healing wounds and increased risk of infections, blurred vision due to damage to blood vessels in the eyes. Diagnosis of diabetes. Doctors diagnose diabetes through several blood tests, including fasting, blood sugar test, measures glucose levels after fasting for 8 hours. Oral glucose tolerance test, OGTT, measures blood sugar before and after consuming a sugary drink. Hemoglobin, A1C test, HbA1c, provides an average blood sugar level over the past 3 months. Treatment of diabetes. The treatment for diabetes depends on its type and severity, but typically includes 1. Medications and insulin therapy. Insulin injections, essential for type 1 diabetes and some type 2 cases. Oral medications, such as metformin, which helps reduce insulin resistance. Drugs that stimulate insulin production, such as sulfonylureas. 2. Healthy diet, high-fiber foods. Vegetables, fruits, and whole grains improve blood sugar control. Avoid simple carbohydrates. Reduce consumption of sugary snacks, white bread, and processed foods. Healthy fats. Include sources like nuts, olive oil, and avocados. Stay hydrated. Drinking plenty of water helps regulate blood sugar levels. 3. Regular exercise. Engaging in physical activities such as walking, running, or strength training enhances insulin sensitivity. Experts recommend at least 30 minutes of exercise per day. 4. Stress management and sleep. Chronic stress increases blood sugar levels, so practices like meditation and deep breathing are beneficial. Getting 7 to 8 hours of sleep improves insulin function and overall health. Complications of diabetes. If diabetes is not properly managed, it can lead to severe complications, such as heart disease and high blood pressure, nerve damage leading to diabetic neuropathy, kidney disease, which may progress to kidney failure, vision problems, including diabetic retinopathy, diabetic foot ulcers, which can lead to amputations in severe cases. Subscribe now and enjoy exclusive content. Television Rocket.